Good afternoon, partners, members and friends of WHISE. My name, as Kit has said, is Kerry Bradley, and I'm the Chair of the Women's Health in the South East. On behalf of the board and the team of WHISE, I want to thank you for joining us for this one-hour webinar, where we hope to introduce you to the new guidelines and the indicator framework for the Victorian Women's Health Services. But before we begin, I do want to acknowledge that we are coming to you on unceded Aboriginal land, the land of the Kulin Nation. We recognise Aboriginal and Torres Strait Islander continuing connection to the land, water and culture. We acknowledge elders past, present and emerging, and any of us that are with today. Australia was and always will be Aboriginal land. As mentioned, we really are pleased that you're able to join us today. So why are we holding this webinar? Shortly, our CEO, Kit McMahon, and the Evidence and Policy Lead, Dr. Rachel Bush, will take you through the specifics of our new guidelines, the indicator framework, and how these can positively impact our shared work. Strategically, we really are at a point in time, and we need to make the most of this time. These new guidelines are a collective effort between the state government and women's health services, and seek to position the primary prevention and gender transformative agencies of the women's health services more strongly in our health system, and importantly, their impact. It's important, as I said, that we make the most of this opportunity, and we will be asking you how this can help you and your work to improve women's health and wellbeing. At the end of the webinar, Kit and Rachel are going to be seeking your feedback, and I know the board of WHISE is looking forward to seeing your responses. So I am going to hand over now to Kit and Rachel to take you through the new guidelines, and thank you once again for your participation and committed support to WHISE and a shared vision for a region where all women are safe, healthy and thriving. Thanks so much. Kit, over to you.
Thank you, Kerry, and thank you for that very warm welcome. Colleagues, those of you that don't know me, my name's Kit McMahon, but I'm also really happy today to be joined by my colleague, Dr. Rachel Bush. And we're going to share this presentation. I also want to acknowledge that we've got directors of the WHISE board, directors from the WHISE board here as well. And I just want to thank them for making that time to participating today. This is a conversation. There will be some sharing up front. It's meant to be a sort of an information sharing session, but Kerry intimated at the start that we are keen to have a discussion with you in plenary to learn about how we can make the most of this moment for all of our organisations. So what we really would like to do is provide space with us today for, to 1 o'clock about, what the new guidelines are and what they mean for our region. We want to seek to start to build understanding about what we're pretty excited about, which is a new evaluation and indicator framework. All women's health services across Victoria are collecting evidence of their impact against this framework. We've got a question about, well, how can we use this with all the work that we're doing in partnership in our region? But really keen to kind of connect with each of our partners about what does it mean for you and the guidelines that you have, or the expectations that are on you and your partners, whether it's a council, a health service, another agency, about how we can use this moment in whatever partnerships evolve. So that's our hope, and we were absolutely clear that we won't get all of the questions answered today, but we're hoping this might be the start of us continuing conversations or meeting with you after this webinar to further understand it as well. Rach, what were you hoping to get out of the webinar today in your role?
I mean, I guess for me, it's giving you all a heads up so that these are the new guidelines. This is what is, I guess, directing our evaluation protocols over at WHISE. So you know what's coming to you, because there's nothing worse than when someone's like, by the way, can you complete a survey? And you go,
oh, that's fun.
But why? What's the purpose of this? And what am I getting out of this other than the joy of completing these questions? So it helps you to understand what are we trying to learn, but also, as Kit said, what can you get out of this as well? Because this should be a two-way interaction. And so when we get in touch with you later on, it's not completely out of the blue, because that can be awful as well when you haven't had time to think about things in your own time. And as Kit said, look, our door's always open. So if you want to discuss anything with us further,
Yep,
we always welcome that.
yeah, thanks, Maureen. So let's get into it. There's a bit of background to this in this moment, but for a few years, the women's health movement across Victoria has been engaging and working with government to do a couple of things: boost our funding, but also to sort of position this service that's unique to Victoria within the sector, or the health sector, more broadly. But as an outcome of the boosted funding that occurred in the 22 state budget, there was also a moment where we could actually strengthen our guidelines. So after about 10 months of development work across two departments, so the Department of Health and the Department of Families, Fairness and Housing, with the Office of Women, what was produced is a set of guidelines and an indicator framework that do some key things. The first thing they do is they strengthen the role of these services within the Victorian public health system and population health. They've boosted the funding for 2 years. We now have new reporting models and expectations, which in effect are saying, don't tell us any more about what mums you're putting on seats. Tell us now how you're making a difference. And for anyone that's worked in primary prevention and health promotion, you can probably start to see the joy of that opportunity if you're doing this in a consistent way across a number of partnerships and services. But in addition to that, the Women's Health Service have looked at that indicator framework and say, well, we actually think we can do even better than that as a collective evidence generating machine. So there's the creation of a collective impact framework that's going to start tracking for things like most significant change outcomes, what's the qualitative stories and narratives and case studies around this as well. So that's what's happening now across Victoria. The guidelines, the new guidelines, and I'm really happy to share these guidelines with anyone who wants. If you want a copy, I'm really happy to share it with you. But for those that don't find reading program guidelines fascinating, they really do, as I said, 4 key things. Right? This, I talked about women's health services considered part of the public health system, not just sort of the program, but the service. There is a really clear delineation between what we take leadership and what we take support roles of across the statewide and the regional women's health services. So you can see now the more clearly, they're being funded to do that, or that sort of support's more clearly available for us. As I said, the guidelines are a combination of 2 departments. So we used to have funding guidelines for programs spread across a few different departments, which is not an unusual situation, but they've been brought together. And this indicator framework that Rachel's going to go into a bit about later, we are absolutely clear that this is an opportunity not for women's health services to show the impact of primary prevention and gender transformative practice, because we're not the only ones that are doing it. Others are doing it as well, right? So let's use the moment to show the value of what that means. So the goals, structures and priorities. All the women's health services now have a vision, a shared vision. And each of the women's health services through their own business planning will interpret this differently. But at the end of the day, this is what we're being asked to do. We're being asked to work to achieve optimal health and wellbeing of all Victorian women and increase gender equality. So when you talk to women's health services, that's the resource that we are providing. The next slide, you'll see that the guidelines were put together by committee, but really they speak to the outcomes that underpin that. And we've just emboldened the key bits. The outcomes are to improve gender equality and reduce women's ill health, the prevention of violence against women, to create and improve gender practices and non-discriminatory practices in workplaces, and work with our partners and create partnerships for prevention and health promotion using an intersectional gendered approach. So that's what we're being funded to do and the resources that we can do. And under those outcomes, there's a set of objectives. Sometimes we call these pillars, but really this is the 5 areas that now we're doing it. Some of those will not be a surprise. Some women's health services are doing all of them. WHISE is focusing on the first 4, and we will expand into the 5th based on need. But gender equality, gendered violence prevention is the terms that are being used in all its forms: sexual and reproductive health, mental health and wellbeing. And Women in a Changing Society is really about gender drivers and impact of disaster. So gender and disaster work. So you've got the vision, the outcomes, the objectives or the pillars. But the other thing these guidelines do is to say, well, how are we going to work? And those of you that know health promotion well, this will all resonate. But what's codified in those guidelines is the way that we work around leading best practice health promotion and primary prevention, that capacity building role, evidence informed, developing skills, and coordinating statewide and regional wide activity. So they really are, there's sort of things we've been doing for a long time, but these guidelines really bed them down a little bit more. Really happy to open up to questions, but Rachel, is there any comments that you'd like to make on that before we perhaps move into this other new bit, which is this indicator framework?
No, I think you've outlined it really beautifully, Kit.
Yeah, I'm really happy if people want to put questions in the chat as well. Feel free to do that as well. Well, with that, Rach, I might hand it to your good self. And in the best traditions, please let me know when you'd like me to move the slides over.
Thanks, Kit. So we're going to dive into the indicator framework. I'm not going to go into the deepest of nitty-gritty like I did for my WHISE team, because that took an hour and a half, and I don't think any of you want to see it frame by frame for an hour and a half. Next slide, please, Kit. But before we take a closer look at the indicator framework, rest assured, as with everything we do at WHISE, we will be applying a feminist lens to the delivery and to the approach. We will be taking a gender transformative and feminist approach. I've put on the slide here what this means. So rather than reading through it word for word, essentially at its core, taking such an approach to the delivery and the implementation of this framework really just means that we want to ensure that it is inclusive and participatory for you all and respectful of you all. And so essentially, what makes a feminist and a gender transformative approach quite unique is that it makes not only your evaluation a positive, a driver of positive change towards gender equality and empowerment of women, but it also makes it a really empowering process within itself for all the stakeholders involved, with the potential to prevent any further discrimination and exclusion. So next slide. So it does this through essentially not just mining you all for data, which can sometimes, you can sometimes feel like that when it's just survey after survey and you think, I don't know what the point of all of this is. So really, a successful gender transformative and feminist evaluation will support all those involved to feel empowered by your participation in the evaluation process and the communication of results. We want you to develop capabilities to participate in broader processes of social change and to feel equipped with knowledge to challenge existing programs, policies, and procedures. So we want you to feel as if you've taken part that you've gained something and that you can go forward beyond and continue the conversations and continue the work and feel really quite able to do that. So next, please.
Yeah, and I think the other thing too, isn't it, is that the partners that you partner with, because a lot of our people we work with, they work with community, and what's the opportunity to build the capacity of community as well. It's really important. Thanks, Rach.
It's all right. So this is sort of at the high level what the indicator framework looks like. Kit outlined the 4 outcomes that we are working towards. This is embedded across all of our 4 priority areas, which are those objectives that Kit spoke to. And then we have indicators which are sort of within the word itself, an indicator of whether or not we have achieved the outcomes, and then measures for how we measure each indicator. So it's really prescriptive, which can feel really dry, but for the people across the women's health services who are in my position, it's really exciting. For the first time, we actually all have clear indicators, a clear way to measure it. So we're all collecting the same data. There's no sort of misinterpretations. And so we all are working towards the same sort of evaluation method. Next slide, please, Kit. So yeah, this sort of is much what I was just talking about. And so we've got our 4 outcomes. Each outcome has 3 or more indicators, and each indicator can have more than one measure. So I'm not going to show you the entire indicator framework because it makes you go a little cross-eyed.
Although if you do want to read it, and we will be very excited to share that with you. We want to maintain the relationships we have with you.
Yeah, so probably it was ahead of today, it would have felt like one of those magic eye things to send it to you, and you may not have wanted to come along because it may have been like, what even is this? But perhaps you'll want to see it following today's webinar once you've got a little bit more of an idea of what it's all about. So next slide, I'm going to give you an example so you have it, so you can kind of visualize a little bit more how it looks. So if we're just looking at outcome 1, which you may recall is improving gender equality and reducing women's ill health, there are 4 indicators for this outcome, but zooming in on one of the very first indicator is increased confidence to apply knowledge of the extent and impact of gender inequality on the health and well-being of women. So that's one of the 4 indicators that we have been quite successful in the first outcome. We'll measure this indicator through the proportion of participants who report that the capacity building. Capacity building is like something like today, a training event, a learning forum, what have you. So those who report that the capacity building increased confidence to apply knowledge of the extent and impact of gender inequality on the health and well-being of women. And the way that we gather data for this measure is in a pre-event and post-event survey. So people will be asked that question that you can see on the screen, which is, please rate the level of your confidence to apply knowledge of the extent and impact of gender inequality on the health and well-being of women. And they answer very poor, poor, neutral, good, very good. So they will be asked that same question before, and then that same question following. We at WHISE also like to collect 3-month follow-up data. So we'd present that same question again to measure that impact and to measure sort of that short to medium term retention of confidence. And so you can see here, it's really prescriptive. It's really clearly laid out for us. So the indicator framework takes a lot of that hard work away out of our hands, which is quite nice. And so each indicator will have a measure or 2 measures, and each measure has its has a question pre-written for how we collect data for that. So moving to the next slide, we have sort of 3 sources of data collection for the indicator framework. As you've just seen, we collect data from individuals, people who attend our training and events in those pre and post surveys. Us at WHISE, we also provide some data, so we answer some questions about like our impressions and feedback on our own work, and as well all of our partners, where we want to find out about your engagement and any organisational changes. So moving to the next slide, we collect data in, well, there's officially one method, which is surveys, lots of surveys. However, as I discussed earlier, we have our intention of applying a feminist lens to the way that we work. We want to make sure that people, our partners, feel like you've got something out of this whole engagement as well. And so rather than mining you for data, sending out a survey every July with 10 survey questions, and you look at some of the questions and you go, don't really get what I'm being asked here, so I might just skip that. Or, oh, this reminds me, actually, it would have been really great to have a chat about getting WHISE's support on this, or I've got some questions about that. Kit, in all of her wisdom, had some really great ideas of how we can approach the partner surveys. So I'm going to hand over to Kit so she can in her own words. But thanks, everyone.
Thank you, Rachel. I think we took the opportunity in this webinar to talk about the guidelines, and you can tell we're spending a bit of time on indicators, aren't we? It's my experience, this is where the rubber hits the road. Because if you don't collect it, then what are we doing? Yeah. The collection of data for me is a hygiene issue in public health and community work. How can we actually measure ourselves in a way that makes us able to collect the evidence to demonstrate impact in a way that's meaningful? So one of the takeouts from today is that Women's Health Services have an indicator framework that is driving a set of behaviours to collect data and evidence. But what we want to do is we want to do that in a way that builds our collective capability and strengthens our partnership. So the proposal, one of the proposals that we're taking to our partners is, from this year, in addition to doing what we normally do, which is when we go out and we do events, and you'll see us doing pre and post surveys, and they'll probably become a little bit more focused now if you're talking to us, right? And out of those pre and post, we produce an evidence report that some of our partners are actually now using to go back inside their organisations and see that was worth it, right? There's that there for you. But now we want to do a couple of other things. We want to have, on an annual basis, formal conversations with those that we identify as partners around these indicators. So it won't be, as Rach said, sending you a survey saying, can you please tell us how you've used gender equality in your organisation to strengthen your organisation? It's an awful way, right? It'll be an annual interview arranged in a way that makes sense to your organisation, either one-on-one or one of a few around those points. That's also a stock take as for the partnership to say, how are we going? Where do we want to go in the next 12 months? Because I don't think WHISE has done that well. I think we need to do that better, right? So that's the first thing that we'd like to start to introduce. And that'll be not done by me, although I'll turn up to any conversation. It'll be done by the people you work with. Yeah. So, we've got Eileen here from Kuirup. It might be a few different people that come to that, but we'll work that out, yeah? Second thing we want to do, and this is more connected to that collective impact qualitative piece. We think that the production of evidence of gender transformative practice in health and community is one that we share with others. And we think what we can do is showcase that better and collect the stories and the cases. So what we want to do is every year put on what we're calling an annual conference. And this conference won't be WHISE standing up there talking to you about gender equity, because that would be very dull, fun, but dull. It'll be a conference where we send an EOI out to all our partners to say who would like to share, showcase and explore the work that they're doing. Not in a way that's it's a bit of bragging, but and saying, look how much we achieved, but also as a learning opportunity for all of us. Informed by most significant change structures and thinking. So what we're kind of talking about with our partners today, and it won't only be done, it'll be done afterwards, clearly, is that we want to collect data in the usual ways, but we want to start to use this moment to strengthen our partnerships through some sort of annual conversation with you, and however that works, but hold a conference probably around August that actually starts to give us the space to learn more and connect more about what's going on in the region. So that's kind of what we're leading up to. We've got new guidelines. We're going to spend a bit of time talking about indicators because that's where the rubber hits the road. But the pointy end of how we're going to collect it, some things won't change. We'll still do those pre and posts in the events or activities or campaigns that we run. The new bit is the real connective tissue piece on how the partnership and how the activity is going, which we want to do through interview and through a conference. So we'd like to now open it up for discussion. Bit of a conversation about how this might work or any views. The questions that WHISE have got is, how can these guidelines add value and strengthen our collective work? Can you see this as adding value and helpful to you, at the LPHU, at the health service, at the council, at the community service agency, at the youth network? And how could you use this as an organisational team to benefit and grow and improve your own equity journey? I guess the questions we can talk about now, but I think a follow-up conversation one-on-one with each of you is what's on the cards. And certainly I've been having those already. We've been very lucky to have those already. So I would really like to open it up to the colleagues on this call to offer any comments or feedback to WHISE as we move into this new way of working or strengthened way of working for us, about how you're responding to this, what you see the opportunities, and indeed if there's anything you think we need to plan for to make this better for everyone.
And we fully understand as well that you haven't seen the framework in its entirety. So this might be something that you'll sort of mull over and reach out later with more thoughts and questions. But we'll send out the framework as a whole. Yeah.
The marvellous Fiona Cost, how are you, mate? Thank you.
Whoops, you know me, I've always got a question or something. I'm really keen to get a copy of the indicators and your whole framework, to be able to sort of put that with the Together We Can roundtable and sort of sit that there amongst the work that we're doing, and to have your guidance also about where our activities and our council's action agenda does align with the work of WHISE. And so there's some real tangible things that we can separate out of the work, because obviously it's Together We Can would probably just be taking on a small part of your whole indicator framework or your guidelines and framework. But to know which ones, so that when we are looking at doing livability surveys or attitudes and behaviour surveys, any of those sorts of things, that we can
Mm.
incorporate some of that stuff so
Yeah,
that
great.
our collection of data can feed into yours and
vice
you know,
versa.
that vice
And vice versa. Yeah.
So, you know, having that awareness and maybe working with our roundtable around
Yeah.
some of the ones that are poignant to our work.
Yeah. And I want to recognise when you raise that each one of us comes to this conversation with our own monitoring and evaluation frameworks and our own funding agreements. Yeah. But I think the opportunity to align and feed the evidence in collectively is an opportunity to demonstrate the connectivity that exists across these systems that we work into. So yeah, Fiona, let's do that.
And I think even though questions like survey questions might be different, or, you know, I think you can still sort of find that marriage between them, that it might be worded differently.
I'm looking at Rachel's nodding, so that's good.
Yeah. So I think it's just about having looking at them with a different lens kind of thing. But I mean, we're all working towards the same thing. So but we might be asking different people for the same kind of information. I mean, a man's interpretation of whether something's had an impact on a woman and their knowledge may still be just as valid as a woman's perception. Yeah, so I just think that it's great to have this overarching framework for our state, but also for our region as well.
Yeah.
It gives us a little bit more robustness, I guess, around evaluation. So yeah, it's good. So please send it to me.
Yeah, done.
Thank
And I
you.
think you probably heard Rachel talk about confidence, right? Now, the use of a measure of confidence to demonstrate success, I think, is an opportunity for professionals in the sector to say, well, how do I know this is making a difference? What does confidence mean? So confidence means more than knowledge and awareness. It means a sense of self-efficacy to act, right? Is that enough? Well, probably is for the moment when compared and in amongst other collections as well. So
I mean, I'll just jump in there and say at WHISE, we ask confidence questions because it is important to know, do you have that deeper level of knowledge where you feel confidence to put to turn that knowledge into practice and into action. And then we go that next step with a qualitative question, and at 3 months follow-up we'll do an interview. How have you put this into practice? So have you felt confident too? Yeah, great. How have your practices or attitudes or behaviors changed, whether in your workplace or just in your day-to-day? And give us an example, because that's where you get that real meaningful impact, that story of impact. So yeah, confidence questions are and you expect to see a drop in confidence at follow-up because the excitement of the training session has worn off a little bit and you go, oh, do I feel? And so this is where it's about going, we're not just data mining. We want to know, okay, so then what can we do in that intervening time? What can we send to help maintain your confidence so that you can go on and feel empowered to continue the work? Would it be some like print resources, maybe some short videos, what have you? So that's where we really want to work with you all.
I was just thinking too about that interview you're describing there is, the opportunity to kind of gather data around not just confidence, but potentially people might have confidence, but then you're coming across all sorts of challenges and barriers, which are actually, making it hard for you to put what you've learnt into practice. So, that's a whole new level of
Absolutely.
data around, yeah, when it comes to getting runs on the board, you know, you've built the capacity of the people that are in the room, but yeah, what are the hurdles that they're coming across,
Yep.
which are, you know, from a day-to-day perspective, making it difficult to put some of this new knowledge
That's
into
totally
practice.
right.
Yep.
It's
And they're
totally
different, so, you know, like I would imagine it's kind of more in the moment rather than, you know, like once a year when you sort of sit down and think back about what's made this work difficult or challenging, or why haven't we progressed as far as we could. You know, it's a little bit more live.
Yep.
Yep.
Thanks, Karen. Eileen.
Yes, thank you, Kate. Sounds good from what I've heard, and I think I'll be looking forward to reading more. I think there's an opportunity, and I think Rachel did touch on that, about the qualitative data that's collected. And is there an opportunity there for us to build some skills around that storytelling and capture of how we share that, like how we tell our stories, share our information? What does it look like to be safe in doing that? And I'm just wondering if that could be something that we could think about. How do we, you know, because sometimes when you reflect back, you haven't got the language or the skills, you know, you're not quite getting there with how to capture the information.
What do you think, Rach?
So are you sort of thinking more about how, so if you're, say, being interviewed, how can you feel secure in sharing your story, but maybe you might look back later and sort of wonder if there's some information that you should or should not have shared, and concerns around confidentiality and the such, or all of
could be, or it could be just you know, like perhaps some examples or some words that help people to describe what they're learning, what they're seeing, what they're feeling.
Sorry, you go, Rach.
I would just say that in terms of collecting qualitative data and interviews, or whether it's interviews or short answer questions, it's a collaborative thing. I mean, it's always anonymous. So if you do an interview, we don't then say, Eileen from Kurirup, like we would, it's completely anonymous. And there's also the opportunity for us to share and say, this is what we've written up. And what are your thoughts on this? Is there anything that you want to add? It's if you're unsure about the language that you're trying to put to what you're talking about, you know, we can work with you on that. It's again, collaborative.
Yeah, I can see Fiona's got a hand. I really enjoy that idea too, Eileen. I think for me, what you've identified is this opportunity to use the indicator framework and the guidelines to build capability of the sector and our community on collecting case studies that demonstrate impact. Yeah, that was where I was. And Rachel's like, we're all on the same page. So I will say here, that is something that I would like to explore. And if we want to pilot through your region, I'm all for that. I think the more of our community workers who are in the field, whether they're faith, whatever, who can capture evidence of what they're doing, I think it's only stronger, makes us all stronger. Yeah, really enjoy that, Eileen. Fiona.
Probably just pick up a little bit more on both Karen and Aileen's comments there too. I mean, one thing that I learned at the Wellsprings for Women's 16 Days of Activism event, which was Voices of Courage, which was absolutely brilliant, was, you know, they were saying about the use of language and, you know, how we do capture stories and the evidence of what we do, and the use of videos and mediums that are very different to what we may be commonly using. And I think about council as well. You know, a council isn't necessarily going to, or not all parts of council anyway, isn't necessarily going to be delivering programs as such. We might now youth services in our early years, etc. But we need to do a lot of other work with regards to gender impact assessments, particularly around, you know, an example might be, you know, we've got a new development, making sure that our footpath system is suitable for women and children or our older communities, etc., and that equal consideration has been put into that. I think we do that already now as part of livability. We've progressed on that one, but it's those kinds of changes that can be captured and is a little bit hard to capture in perhaps a survey. And so, but it's still really important. Systems change. And so being pretty smart about how we tell the stories of systems change in some of those areas of that are more patriarchal in the way that they've traditionally been delivered, you know, like our engineering, etc. Areas. Does that kind of make sense?
Yeah, totally. Video is a really powerful tool for storytelling completely, and it gives the opportunity for people to share in their own voice, and I think it can be a lot more accessible to a wider audience. And as you say, Fiona, a survey isn't always the right way, especially if you're trying to capture stories. You don't quite get that. And certainly not worrying about the use of sector language and whatnot, but just simply storytelling.
But also using the values-based messaging framework, you know, and around the barriers and identifying, you know, well, what were some of the things that made it difficult to achieve? You know, what was your original vision and did you meet that outcome? And telling that story can be very powerful than the data on a sheet as well. And, you know, I mean, that sort of stuff takes time, of course. It's valuable time, but often organisations aren't in a position to be able to deliver that sort of stuff. So maybe having a bit of a brains trust around how we might be able to do that better while still meeting those indicators.
Sorry, you go, Rach.
So I was just going to say, so yes, the indicator framework is it's just quantitative pre-post. That's the data that we must report. And we apply our feminist lens as far as we possibly can with it. But then, as Kit mentioned at the start, we are also, all the women's health services, we have developed a collective impact framework. And so that's where we go beyond that quantitative structure to bringing a lot more qual in, follow up, looking at impact, looking at most significant change, and reaching out to stakeholders and partners, and getting a lot more of that deeper storytelling, so that we can really show our unique value as women's health services.
But also the unique value and impact of gender transformative practice that we're all trying to grow and learn from. And there is multiple drivers to do that. I think, Fiona, what I'm enjoying about your observation, and I've written a little note directly to Rachel Bush in the chat that you can't see, that says, stories of system change. I can see a forum. You know, like what platforms, what technology, what capability can WHISE host that through our partners we can come together to enable that to occur? What vehicles can we provide for the livability partnership or the Together We Can partnership or Rodney, whatever the LPHU's kind of emerging partners are to sort of do this, you know, the City of Stonnington, the community safety committees as well, that those stories that emerge that are about saying, well, we are creating world peace here and this is how we know we're doing it, that can be captured. Because as Rachel keeps saying, who is the best quant that I've ever come across, right, in my world, she makes it understandable. You need both.
Yeah, I reflect back to a project that was done with Together We Can, and that was the Voices of Children, and they were asked around a series of questions.
Right.
Yeah, around what's their perception of gender equality? What does respect and equality look like to them? Now that's real change. That's intergenerational change when you hear them, but it also showed where change hadn't happened yet. You know, so some of the older ideas were still with children. You know, other data that's really important is, you know, how many kindergartens give their uniforms still in blue and pink, you know, or are they bringing in a whole heap of different colours now, or do the boys always have blue and the girls always have pink? That sort of, those sorts of information as well, sort of tell stories as well.
Because it will. Colleagues, I'm aware of the time, and if I can give people 5 minutes back in their day, even at the start of this year, I figured that's a lovely thing to give to people. So just reading the virtual room, I might seek to kind of pull together perhaps what I'm hearing. I think the first thing I'm hearing is that the people on this call would welcome seeing those guidelines and indicator framework, right? So I'll send it out. Of course, you don't have to open the document if you don't want to. I think the other thing I'd like to do, I'm following up with a few folk after this meeting, our partners, to talk about what this means for you. But just know that if I haven't contacted you yet, you'll get a little email from me to say, can we catch up? Right? We can do that with one of your people in your organisation, or you might want to get a few people together. It's up to you. It's an evolving conversation. I haven't heard any, oh, don't do that yet on the conference. So we'll just keep exploring that. And I think the other thing I'd like to do is put forward to you, if we have these one-on-one conferences, I would like these partnership conversations to be something that becomes a way of not only producing data, right, but also a way that we can make sure that we're doing good work together and not wasting, or that we're not wasting your time, or are we on the right committees and all those sort of things like that. So trying to use this moment to do a few things. Create data for impact for WHISE, for women's health, but also that whole thing we're trying to do, which, as I keep saying, is creating world peace and the value of primary prevention in all its forms. I can see heads nodding. That's a really good thing. I might close it up, Rachel, and we might give people 2 minutes back in their day.
Yeah.
Do you have anything else that you'd like to add at this point?
No, other than thank you all for coming and at lunchtime and listening. And we really do welcome you to send through any questions, or if you want some deeper explanation, we can provide all of that. We're here to support you and make sure that this really works for you as well.
Thank you so much, everyone. Have a wonderful rest of the day. Take care. We look forward to seeing you in person in a post-COVID world very soon. Take care. Thank you. Bye.
Thanks.
Bye.
Thanks so much.
Bye.